Hi, it's Erin here and Rose from Baby Beats. Today we are going to show you some exercises that you can do, some stretches to help with carpal tunnel during pregnancy. So all you need for this is yourself. You don't need any equipment. I'm going to do it sat down and Rose is going to demonstrate it stood up. So just wherever you feel comfortable. So once you're ready, we'll get going with those stretches.
So we're going to start with a really simple stretch. We are just going to reach one hand out and we're going to have your fingers facing downwards. We're gently going to grasp your fingers with your other hand and then just really gently pull backwards. You'll feel that stretch right down your wrist there. How's that feeling for you?
That feels nice. I've been struggling with carpal tunnel. I'm 35 weeks pregnant now, and I would say it was sort of as soon as I got into the final trimester that I started to struggle with it. And it's something I learnt about when I've done pre and postnatal courses, but I had no idea how painful it actually can be. It's such a bizarre feeling.
So you can do these whether you're pregnant or not. Some people do suffer from this in their everyday life, and like you said, it can be really, really painful. The reason why you can get carpal tunnel, which is really fascinating, is that your blood volume actually doubles during pregnancy, which is amazing. You've got double your blood flowing around you right now. We're just going to switch around now the opposite way. So we're going to have fingers facing upwards and we're just going to gently ease your hand back. So try not to pull on your fingers, that's it, fab, as we just hold there. Which I just love the facts that you learn about pregnancy.
It is all things that you just would never know until it happens to you.
Yeah, so especially circulation as well. Let's switch to the other hand.
I'm appreciating now. I was really struggling a few weeks back because the weather was hot and my hands were really swollen, my feet were really swollen, and it was so much worse. But the weather's cooled down a little bit now, which is such a relief. I'm still struggling with it. It's stopping me sleep a little bit at night, but it's a lot better now the weather's cooled down.
So we're going to do a video after this one as well. If you are struggling with any circulation problems and struggling sleeping, check that one out because it's going to give you some really simple stretches to do. The next one we're going to do is we're going to pop your hand down by your side, so you can do this whether you're standing or sitting. And all we're going to do is lift your fingers and we're going to turn your head away from that hand and then just drop your chin.
Oh, that feels so good.
Yeah, it's quite a nice stretch.
And my neck and shoulder.
Yeah. Trying to keep your shoulders down as well. We're so used to lifting our shoulders up all the time. So breathing into that stretch. And you don't need to hold these for too long, 30 seconds to a minute, however feels comfortable. If at any point it doesn't feel comfortable, then please make sure you stop. If you're not used to doing any of these exercises, then please make sure that you do check with your GP or your midwife if you are pregnant, just to make sure that you are okay doing them. That feel all right there?
That feels really good.
Let's switch to the other side. So we're going to push down. And then we're going to turn your head and then just drop that chin down. It's really nice for your neck muscle, this one as well.
Yeah, just by dropping your chin down as well feels really good.
It can slightly feel like you're restricting your breathing as well in this position because we are dropping your chin. So just trying to focus on those nice deep breaths in through your nose and then back out through your mouth. And then let's come back to centre. We're just going to do a few shoulder rolls here. Just because I love a good shoulder roll.
Yeah, me too.
Just stretching back. And then we're going to bring your hands forward. We're going to clasp your fingers together and we're going to stretch your head forward. So if you're sitting just like Erin's doing, we're just working on that upper part of your back. So we're not getting your whole of your back involved. It's just that upper spine. Head drops down and you'll feel a really nice stretch. We're getting that circulation going through your arms as well, getting the blood flowing back towards your torso, and again making sure those shoulders are nice and soft while you're in that position there. Do you feel all right there?
Yeah, it feels nice.
Brilliant. And then when you're ready, we're going to come back up. If you really like that one, you can repeat it again. You could do it 2 or 3 times. And then we're going to go the opposite way. So we're going to pull round. So if you're on a chair, if you turn sideways on, then you've got a bit of room behind you. That's it. Again, so we're thinking about just this upper back, so we're not overarching on this one, just as Erin's doing there. It's up to you how high you're going to lift your arms. You don't have to lift them up high. It depends on your shoulder mobility as well. That's it, so you can keep them quite low. If you feel like you can lift them that bit higher, then you can do, but no need to hold for more than 30 seconds to a minute. Are you feeling all right there?
Yeah, it feels nice in my chest as well, in front of my body.
And then we'll bring those arms back down. Give them, again, shoulder roll after everything. Last one we're going to do, and you can do this standing or seating, is a little bit of a side bend. So again, we're working on that circulation of your upper body. I like to imagine I've got a nice old-fashioned corset on for this one, and it's going to give you that nice lift. I mean, maybe we don't want a corset on when you're 35 weeks pregnant, but the lift first is you're lifting up, and then we're going to lift up and over to the side, keeping that shoulder nice and relaxed. And then back to centre. If you are doing this and you are in the later stages of pregnancy, we want to keep this movement fairly small. We don't want to be squeezing baby too much, but we can have a nice lift up and over. You probably do this in your everyday life without realising, when you reach down to pick something up or when you're carrying your shopping bags.
Yeah.
So it's just, again, that functional movement that we're always looking at, supporting the body in its everyday movements. Does this feel all right for you?
Yeah.
You can add, as you go down, a little flex of your fingers, and then back to centre. So if you want to add that in there, especially if you are suffering
That does feel nice all the way down the arm.
Yeah, you'll have to do these in the middle of the night if it wakes you up.
Yeah.
And then you can let everybody know how much it's helped.
Yeah, it feels good.
Fab, let's just do once more the other side. And then back up again. I hope you enjoyed those few exercises to help with carpal tunnel.
Yeah, you'll definitely have to let us know in the comments if you are suffering with carpal tunnel and what you've actually done to help ease that as well. We'd like to hear what you've been doing at home as well to help with that.
If you want to watch any more of Baby Beats videos, we have got all sorts of videos, especially about pregnancy, pelvic stability and stretchy ones as well. You can look at all our videos at Baby Beats UK, or
you can find me as well on Erin Blackburn Fitness.
thanks, bye!
Bye!